I've been a walking heartache, I've made a mess of me. The person that I've been lately ain't who I want to be.
I want to become a doctor because surgery is really interesting. The human body's interesting. There's a lot to it, and there's a lot that you don't really think about that goes into maintaining your body. I want to get into either thoracic surgery, which is chest surgery that's not related to the heart, or some type of kidney surgery, nephrology. I interned at Syracuse University at an Associated Medical Professionals clinic and Krause Hospital. I was in the clinic during patient and doctor consultations, so I watched diagnoses and in-clinic treatments. My least favorite part of it was watching prostate exams and catheterization. The best part though was I got to watch a lot of surgery at Krause Hospital, about 3 dozen surgeries, and the best part was seeing a kidney get removed. I learned a lot about surgery techniques in removing kidney stones and removing prostates, as well as how to diagnose prostate cancer and how to diagnose that someone has a kidney stone or a tumor. In 15 years, most likely I'll just finish being a resident and an intern, and I'll be starting to practice on my own as a surgeon.
To help people. That's really what it is. It's all about the athletes. It's all about the kids. It's all about keeping athletes in their given sport as healthily as possible for as long as possible. I mean, injuries are going to happen, and that's why I'm here, but to help them. I think I handle stress pretty well. My job is a lot of multitasking. If you can't multitask, then I think you're going to have a really hard time in like a high school setting being an athletic trainer, because you know, you have everybody that comes in all at once and wants just needing to get ready for practice. Like, you know, that's the prevention part of the profession, I guess. So everybody comes in at once, and you kind of have to be able to juggle a couple things around and be delegating, you know. I usually have interns in here that help me out a lot too, so, you know, pointing them in the direction that they need to go, or where they would be the most useful. The most recent injury I dealt with was a knee injury during a basketball game. It was an ACL tear, and it was actually the third time that the athlete had torn her ACL, so it was pretty big. I come in, and I have a little bit of time before athletes come in normally, and I can catch up on some paperwork and, you know, go make copies or send faxes. But then usually as soon as that bell rings, kids are coming in to get ready for practice, and it's a little chaotic, a little busy. Then it calms down a little bit once they go out to practice, but then it's usually still pretty busy in here doing rehab and treatments, and any like brand new injuries that need to be evaluated I look at then. I don't really keep track of how many extreme injuries I've seen, but at the very least once a season I'm referring somebody to the ER for like you said, like a big laceration for stitches, or there's several that, you know, need to go on to see doctors or orthopedics and have surgery or something like that.
Really, I think it goes back to when I was in high school. When I was in high school, in the small town of Greenville, Ohio, the people that were around to inspire me, you know, happened to be doctors and lawyers and professional folks like that, and that kind of led me to, you know, think about science and think about a people sort of job, and putting those two things together. And you know, then I went to college, and you know, some of the science classes further inspired me, and what happened was that just kind of kept going. It was about science and math, and then, but really most importantly, working with people. It's a little personal triumph for me, helping a guy out that's now 9 years down the road from, you know, what was thought to be probable death to now surviving and thriving. But to be honest, it's a team effort, and that's also what's kind of good about being a doc. You work as a member of a team to help people out. Being a doc is very time consuming, and it really does consume a lot of personal time. What has happened is being a doc, and I tend to do a lot of my own work and work to help people out. And what I end up doing is, believe it or not, I give patients my pager number, and that allows them to get a hold of me even on personal time. My gosh, just yesterday I was out with my wife on a car trip. We were going to do some personal time, and the pager goes off, and so going down the highway, I needed to call her back, and we talked. And actually, that's okay, because what we talked about was adding some therapy to help her out, so she wouldn't have to go to the hospital. And even though that was on a Saturday afternoon and personal time, that's okay. As a doc in this career, I've become kind of a specialist, and that means that I am a lung doctor, but as the career has gone on, and you can kind of tell I'm, getting into the career, getting in toward the end of the career. I'm still in my 50s, but moving right along in the career. And what has happened is I end up doing about 5 things over and over, which is a good thing for me in the career, and the opportunity to kind of make the career a little bit tailored to what I do and what I like to do. So I do chronic obstructive pulmonary disease, COPD, which is chronic bronchitis and emphysema. It's kind of a smoker's lung sort of problem. I do asthma, which is an inflammatory condition that affects all kinds of people. I do sleep apnea, which is sleep disordered breathing, and sometimes that's involved with obesity. And so what's kind of interesting, a couple of those things on the list are smoking related or obesity related, and those are still 2 big problems that we have, what a lot of folks struggle with, and it turns out that I kind of deal with those things. Another thing is the pulmonary arterial hypertension that I kind of mentioned before. It's high blood pressure between the right side of the heart and the lungs, and that's interesting. A lot of developments are going on there. And then, of course, nasty tumors of the lung still have to deal with quite a bit. Handling stress in an emergency situation, I think, has a lot to do with being prepared. I can remember when I was back in training and was a doc early on in the career, you never knew. You were in the hospital on call, and they could call a code, and that's a situation, an emergency situation, where somebody in the intensive care unit or in the regular part of the hospital was having an emergency situation, and they'd call a code, which meant the doc would need to kind of run to the scene along with a team of people and try to help resuscitate that person. And I can remember early on in the career wanting to be very prepared, and so in the call room, in the middle of the night, before trying to catch a little sleep, I'd run through the code protocol and make sure that I felt prepared, even though I had done it a few times. Kind of needed to lead that team approach in an emergency situation, and feeling prepared. That's how I kind of handled the stress of the situation, and then kind of doing that and practicing that, and then the experience, like we all have in whatever line of work we do. We prepare, we learn, we get comfortable, and then stressful situations, although emergencies are always stressful no matter what, if you're prepared, if you've practiced, if you've done it over and over again, then even another emergency situation you feel like you're prepared for, and you can kind of take a deep breath and then know that you're there, usually with other people, and can work as a team to help out people. And the whole idea is you're prepared, you know you can just try to do your best, and you work as a team.
Would you